the cone biopsy did not, I mean, I was under, so obviously I didn't feel it. The only time I was like scared, anxious, was as soon as they wheeled me into that room for surgery. And it was like, oh God, this is happening. And then I woke up and, there I was. It was like I had just been asleep, which is very weird. I did get sick from the anesthesia, which makes me really nervous about upcoming surgeries, but I did. Only once, thankfully, no more than that. And I went home, it was on Friday, and went home and did pretty much nothing for the next few days. I was crampy and in some pain for about the first 6 days, and on the 6th day it started taking a turn for the better, and I started feeling better. I still have, I'm not quite at 2 weeks out yet, and I still have some just residual pain, like I'm just aware of it being there on my left side, because that's where they took the majority of the chunk, and but it's much better than it was. Then from there I got my results and it turns out that the cone was still AIS, so still that adenocarcinoma in situ, but they said the margins were very close. They actually used those words on the pathology report, extending very close to the margins. And then my deeper ECC, though, it came back full-blown adenocarcinoma. So that means it has permeated the outer membrane. We don't know how far yet. It may be very superficial. It may not be. I don't know. But I was scheduled, I went to go see, I was referred to a gyne oncologist. So I had that appointment this week on Monday, met with her and her team for the first time. That was kind of an odd experience to go to a cancer center and know that I'm a patient. I'd like to do a video on that too, just all the feelings with this. It's a lot. But I knew what my plan was going to be. I knew that I was going to be getting a hysterectomy. That is the treatment of choice for AIS, because it skips around and because it's hard to know where it's at, especially if it's up higher in the canal or in the uterine lining. And so they just take everything. But I left there with an actual treatment plan. I'm having an abdominal radical hysterectomy in July. What that means is that it's a traditional hysterectomy. They will open me up on my bikini line horizontally and remove cervix and the uterus and the fallopian tubes. I do have a choice to keep my ovaries, and I'm not sure what I'm doing yet, but I do have that choice. They'll also take surrounding tissue and all the lymph nodes in the abdomen. So, and then from there, that will be sent to pathology. I don't really know my stage yet. She told me that I'm, a stage 1, but there's lots of sub-staging within a stage 1. And it's all dependent on the depth of the spread, if it's in any lymph nodes. So I won't know that until final pathology from the hysterectomy. If it's in even one lymph node, I will have to have radiation and possibly chemo as well. So that's another whole ball of wax. But that is where we stand as of right now. That will bring you all up to speed on where I'm at, my diagnosis, and what my treatment plan is. Like I said, I have ideas for future videos on the emotional journey of this. How am I emotionally preparing? How am I physically preparing? How am I preparing my house, and what am I buying for the surgery? Because hysterectomy, an abdominal hysterectomy is a pretty major surgery. There are different ways that you can do hysterectomies, and this is the most invasive way with the longest recovery time. I will be off work for 2 months. I guess I wanted a vacation. So, that's where I'm at. If anybody has any questions or you'd like to know more about a specific part of what I've talked about, any of the procedures or what it's been like working with doctors, I've never had any health issues, so this is all brand new to me. Any signs or symptoms that I may have had leading up to this, I'm happy to talk about any of that, and really want and hope that this is a resource for people. And if it's not, maybe it will be 10 years from now, who knows, but I just want to be able to do this for myself and for others. So, yeah, that's about it, but I will definitely be posting again soon, and if you have any thoughts or questions, please feel free to message me or comment down below, and I'll get them answered. So, all right, thanks everybody. Bye.